Brain on Fire follows the journey of a 21-year-old New York reporter, Susanna Callahan, as she falls ill and struggles to regain her life back from a debilitating sickness. It is based on true events and denotes the onset and progression of an immune disorder that had only recently been diagnosed. This disease is called anti-NMDA receptor encephalitis. Susanna was a normal, healthy young adult that had no history of any neurological or psychological diseases or symptoms. The story follows her through the multiple stages of the illness, each stage presenting with different and unique symptoms. The 4 stages of this illness are as follows. The primordial phase, meaning the period between the appearance of the initial symptoms and the full development of cold and flu-like symptoms. The illness phase, which is broken into 2 distinct blocks, the neuropsychiatric symptoms and the neurological complications. Then the recovery and relapse phase, and lastly, the late phase that explains the continuing complications. The first phase of this illness, or primordial phase, often presents itself similar to a cold. Almost 80% of patients experience these symptoms, the main symptoms being headaches, lethargy, upper respiratory symptoms such as difficulty breathing, blocked nose and coughs, as well as fever, nausea, and myalgias, which is defined as muscle aches and pains. These symptoms often occur in a period of 5 days to 2 weeks prior to the onset of the second phase of the illness, which causes behavioural changes. Due to the progression of this disease, patients are often misdiagnosed with psychiatric disorders. The main disorder is for schizophrenia. This is what happens to Susanna. Her doctors were having trouble diagnosing her and hypothesized that it was most likely schizophrenia. Though schizophrenia was the most probable diagnosis to explain her condition, not all her symptoms matched this psychiatric disorder. The misdiagnosis of schizophrenia for anti-NMDA receptor encephalitis is quite common due to the onset of the symptoms of the second phase, which result in the neuropsychiatric symptoms and will be discussed shortly.
The second phase of this illness usually begins 2 weeks after the initial symptoms. During this phase, people usually have disorganized thoughts and behavior. They might start seeing and hearing things which aren't there. They may become paranoid. They tend to have increased levels of anxiety, fear, or agitation, and they also experience a deterioration in thinking, communicating, and understanding. During this phase, people may also experience extreme mood swings and a decline in speech and language. And the changes that we see in the person's speech often continue throughout the later stages of the disease as well. Many of these symptoms are usually also seen in a number of psychiatric conditions, but especially in a condition called schizophrenia. Schizophrenia is a serious psychiatric disorder that also affects a person's thoughts, feelings, and behavior. So anti-NMDA receptor encephalitis may be really difficult to clinically diagnose at this stage because it could easily be mistaken for schizophrenia or another serious psychiatric disorder. But one of the main differences between encephalitis and other psychiatric disorders is that seizures are also a feature of encephalitis. So while they're not usually a feature or a symptom of psychiatric disorders, they're very common with encephalitis. So electrical impulses in the brain enable the brain to communicate with itself and the rest of the body through the spinal cord, nerves, and muscles. And any disturbances in these electrical impulses in the brain can lead to seizures. Seizures cause uncontrollable jerking and shaking movement of the entire body, and they can be provoked by a disorder or a condition that irritates the brain. So as you can see, all these symptoms would seriously impact a person's ability to function in their normal daily life. What we would see in a person with anti-NMDA encephalitis in this second stage is a gradual decline in their ability to function in their day-to-day life, along with some really obvious personality changes, such as unpredictable mood swings and increasingly bizarre behavior. And as we shall see a little bit later, these symptoms actually get worse as the disease progresses. But first of all, let's have a closer look at how the brain works and what anti-NMDA receptor encephalitis does to the brain.
Anti-NMDA receptor encephalitis is due to an immune response which targets NMDA receptors. Antibodies attach to the receptors, which triggers an inflammatory response, resulting in the body identifying the NMDA receptors as harmful. This results in the NMDA receptors being destroyed. It also prevents chemical messengers called glutamate and glycine from attaching to the receptor. NMDA receptors are ligand-gated ion channels, which when excited, open and allow the influx of calcium and sodium ions. NMDA receptors in their inactive state have magnesium plugs, which prevents calcium and sodium ions from passing through. A glutamate neuron in the brainstem communicates with the dopamine pathway to regulate the release of dopamine. When NMDA receptors are activated, they inhibit dopamine release through a neuron in between the glutamate neuron and dopaminergic neuron called a GABA neuron. If NMDA receptors are not activated, then GABA is not released and dopamine neurons are not inhibited, meaning they will release too much dopamine. High levels of dopamine are associated with psychotic symptoms.
As symptoms progress, the sufferer will enter a state of catatonia. They will be unresponsive to sights and sounds, almost appearing to be unconscious. This can be seen in Susanna's case, when she is laying back in bed, not replying to things said to her by her family and friends. When a patient is in this state, it can almost appear that they are not aware of what is happening around them. However, this is certainly not the case. Similar to coma patients, when a patient is in a catatonic state, they may be capable of perceiving elements of their surrounding environment. Unlike a coma, when someone is rendered catatonic, they may still be capable of limited communication, which can play an important role in their treatment. In the case of Susanna Cahalan, doctors were able to figure out what was happening to her brain by looking at her drawing of a clock, as it showed that she was experiencing hemispheric neglect when she drew all numbers on only the right-hand side. People afflicted with anti-NMDA encephalitis also experience muscle rigidity or stiffness and irregular movement. These symptoms are caused by the imbalance of certain neurotransmitters in the brain. Think of neurotransmitters like messages that the brain sends within itself to keep the body working. When a person is suffering anti-NMDA encephalitis, some of these neurotransmitters related to movement begin to build up to levels that they should never reach. When this happens, the patient's ability to move is impacted, their movements become irregular, and their muscles become extremely rigid. This rigidity in movement can be seen in Brain on Fire, when doctors are able to pose Susanna like a doll. Her muscles had, at the time, become so rigid that her arms didn't fall limp when someone else lifted them and let them go. Additionally, because of this rigidity, she was unable to walk without aid, as her legs and feet were so tense that she couldn't place her feet flat on the ground.
The third phase of anti-NMDA receptor encephalitis is the recovery and relapse phase. The main treatments are immunosuppressant medications such as steroids. Immunoglobulin and plasma exchangers are also used. Immunosuppressant medications suppress the release of antibodies which attach to the NMDA receptors. This means that glutamate and glycine can bind to the receptors again, and NMDA receptors can begin to inhibit the release of dopamine. This also prevents the destruction of NMDA receptors. Other useful therapies are antipsychotics and mood stabilizers, such as antiepileptics, which can treat some of the symptoms while the levels of dopamine return to normal in the brain. The process of the recovery is almost a reversal of the symptoms as stated before. It generally requires 3 to 4 months of hospitalization, and as for the different functions, cognitive and psychiatric functions are the slowest to improve. Approximately 75% of patients with anti-NMDA receptor encephalitis have full recovery or only mild problems. It can take 8 to 12 weeks to show signs of improvement. As for relapse of the disease, it is relatively low, with approximately 20 to 25% chance of relapse. To prevent relapse, often immunosuppressants are given for 1 year post-diagnosis at least. However, the problem with this is some of the patients who relapse will relapse 1 year after their first episode. Phase 4 of this disease is known as the late phase. Due to how relatively new the disease is, there is no research which follows up patients 5 years after their most recent episode.
Research does suggest, though, that majority of patients recover after 18 months. However, there may still be some cognitive deficits remaining. They may have problems with executive functions such as planning, decision-making, motivation, and behavior. Patients may have prolonged problems with impulsivity, and they may have abnormal sleep patterns. These deficits in cognitive functioning often require intervention by a psychiatrist and medication. In Susanna's case, she fully recovered from this disease and was able to lead a productive life. Susanna's case was interesting because she was one of the first to be diagnosed with this disease. Thanks to Susanna's career as a writer, she published her story as a memoir and raised awareness of the disease.